I had a neck pain through here and going through my shoulder, and I work with a computer all day.
Right.
So I contact my Argo person to come out and adjust the tables, chairs. I changed my pillow when I'm sleeping. I thought maybe that's what it was. And I do some of the, Pilates and exercise. I thought maybe that might have something to do with it. So I modified everything. Still, it was getting to the point of I was constantly putting medication on it because it's just always painful there. And he mentioned that when I came here and had that procedure done. And even then I was going, I wonder. But I could really see the difference.
Right.
That the pain is much more subside. Yeah. I think what I wanted to share, because I have a phobia about dentist. I always say I would rather have another child than have go see a dentist. So if anyone says go in and have a gum surgery, and we all know how painful it is, I will definitely seek this first, give this a shot, because he showed me a picture of a person that had a very similar problem that I did. And that kind of opened my eyes, and do some research on it. And I think it's, your health is your responsibility, and give this a shot before you go in and do any kind of gum surgery. It's just amazing.
Correct.
And I don't use that lightly, amazing word. But to me, it's finding a good doctor that knows how to do it and understand why it needs to be done and the whole concept behind. Then I think it'll be good.
Right. So it's very important.
And how's that feeling now?
Wow.
How would you describe it from when you came in to now?
It just feels more aligned.
Yes.
It feels more relaxed more than anything.
Yes.
I don't know if
That's the key issue.
Yeah.
See, the muscles relax when the teeth touch correctly. It's not a muscle problem, it's a tooth problem. There is a school of thought that thinks it's a muscle problem, but that's not really true. You can relax the muscles, but if the teeth aren't meshing correctly in centric relation, centric occlusion as one and the same, then the muscles are going to re-tense or recontract. They build up lactic acid, create pain, and then they lay down fascia, myofascial tissue as an inflammatory response, and then they become more tense and harder to manipulate. And then oftentimes we have to have a masseuse go in and actually do deep tissue massage to break up the myofascial tissue. And it's just like a leg injury and running, so it's exactly the same.
Yeah, I really never ever thought that your mouth can actually be tensed up, ever.
Yeah.
So.
Now you said that you had some back of the neck pains.
Yeah, it's around shoulder and back of my neck, and I couldn't understand, and maybe possibly this might, because I believe after doing some research as you requested.
Yes. Well, have you noticed any difference in the 2 weeks?
Yeah.
I've seen you? The skull, the head is about 8 pounds, 7 to 10 pounds, but that's a heavy load. To have this jaw open, the head has to brace so that the jaw can open. So in order to brace, the trapezius muscle, which inserts on the top of the skull about 3/4 the way up at the superior nuchal line, and then it inserts down here on the shoulder blade and the clap in the shoulder, then that has to brace, and if it's bracing all the time because the teeth are the fulcrum and they're causing the jaw to slide subconsciously, you have to tense the neck to brace the head all the time. And so a lot of times the pains from the shoulder and neck will be a primary pain dysfunction that the patient seeks out treatment for, but doesn't relate it to the dentist. So they end up in a medical office or chiropractic
Exactly.
office.
I've done that, and then I've also had because I work with a computer all day, so I had an ergonomic person come out, readjust the tables, readjust the chairs, readjust everything. I even changed my pillows. Nothing.
There you go. Yeah.
Nothing.
How's that feeling?
Oh God, that's
You really-
that is amazing.
Isn't that something?